Hi, this is Gene Ransom going through New Maryland Health Laws 2020, Board of Physicians Sunset. The Board of Physicians Sunset legislation did pass during the 2020 shortened General Assembly session. A sunset bill is a bill that reauthorizes or reviews the authorization of an existing board or committee. Uh, the Board of Physicians Sunset came out of a review from the General Assembly last year. This is great news for the citizens of Maryland. Obviously, we want a board to license and discipline physicians, and that allows this to continue. There's a lot of information in the Sunset Report that you can review and recommendations and things the board will be implementing. But I'm going to focus on two big issues that were of major concern to organized medicine. The first was the issue of expungement. MedChi, the Maryland State Medical Society, has been trying to figure out some type of expungement situation for minor issues, and we've had a lot of difficulty. We tried legislation a few years ago, which fell on deaf ears. As a result of the discussions around the sunset legislation, the Board of Physicians and MedChi, the Maryland State Medical Society, have worked out a roadmap on how to review and work through a game plan to come up with expungement legislative proposal that we're going to try to get together and move forward in the 2020 session if we can reach a compromise. This is a major win for organized medicine, who's really wanted to work on this, and we really appreciate the board's willingness and their agreement. Ironically dated Valentine's Day, February 14th, 2020, to work with us on the expungement issue. Another issue of big concern to organized medicine is the number of peer reviewers. When the Board of Physicians reviews a doctor who's breached the standard of care, MedChi really believes there needs to be 2 peer reviewers and a third who's used when there is a disagreement between the 2 initial reviewers. The General Assembly made no change to the law that currently requires 2 physicians and said they would do a study on the rules around a third reviewer, which is something that we really would like to see work done on how peer review is done to make sure that it's done fairly and justly. These were 2 really big issues for organized medicine, and it's exciting to see that there's a roadmap to work towards resolution on both of them. We're also excited because it seems that there is a strong working relationship with the board to work on these issues collaboratively, and I think collaborative relationships with the Board of Physicians and MedChi is a positive. If you want to learn more about the Board of Physicians or healthcare legislation in Maryland, MedChi, the Maryland State Medical Society, is your advocate, your resource in your profession. You can learn more at www.medchi.org.